I know the email went out, I think it was Monday, about what we're talking about today. And today is the topic is scheduling patient care in. Sounds really basic, but not everyone does this. It's one of the easiest ways to build and maintain a practice. Like I said, some offices do it really well, some do it, and some do it poorly. So those who are not scheduling patient care, you have a huge opportunity for growth. That's simple, right? So what are the benefits of scheduling patient care and pre-scheduling patient care? Like, why would we want to do this? Okay, firstly, I believe it shows confidence in what you do, right? Imagine going into an office and someone says, this is what you need confidently, versus going into another office and saying, we're going to try this out for a bit and see what happens. Which practitioner would you want to start with? You want to ask
Right.
yourself that question, right? So we're all customers as well as practitioners, right? Would you want to be going to the surgeon that says, oh, we're going to try this out for a bit? Or the surgeon that goes, we know exactly what we need to do. So confidence in your delivery is super important. The patient also gets predictable results on a schedule of care, just like a gym a membership. If you go here and there and you try to get fit, it's not going to work out. But if you're going often, you're going to get much better results. So it's the same for care. The patient also, when they commit to a schedule, they know what's expected of them right off the start. They're not going to be wondering what's going on next week, what's going on the week after. Is once they know what's going on for a period of time, whether a month or two, they're going to be more apt to stay on schedule. They're also not going to judge their care based off of symptoms, right? Because symptoms can go in a couple of weeks or so, right? You're going to create the schedule based off of their goal, right? And usually it's how they function. Therefore, the schedule is necessary in order to correct the problem. You're going to schedule them based off of their function, not off of their pain. And it really avoids decision-making fatigue for the doctor, right? Think about a typical day. Let's say a doctor's seeing 20 or 30 patients a day. If they don't have a schedule laid out, you have to make 20 to 30 decisions with these patients on when they're going to come back next. And that can create decision fatigue or fatigue in general, right? You want to limit the amount of decisions you have to make in a day. So you want to set that schedule with that patient and just hit go, hit the go button, right? And it also avoids unnecessary scheduling at the front desk. Every visit, that patient has to sit down, stop at the front desk, and have a discussion with the staff, and it really can bog the desk down. And I want to just bring Dr. Carla in on this. And what is the? I know a lot of people don't like the pre-schedule care. What is the really big advantage for that front desk to have the patient on a schedule of care?
I think it eliminates getting the front desk too bogged down in terms of people waiting to pay and book an appointment. But the one thing that we always stress with the CAs that we help and coach, and even CAs in our own office, is making it appealing to the patient, giving them the why behind what you're doing. So if you have patients that are committing to care a couple times a week and want a really popular time, so let's say they want 5 o'clock on their way home from work, that can be more difficult to add in at the last minute. So making it appealing to them can be important, and telling them the why behind what you're doing. But to get back to the question that you asked, I think primarily it is eliminating even the decision fatigue for the CA. Because yeah, the doctor doesn't need to be making that decision every time, but the CA doesn't need to be struggling to find the right time that works for that person every single visit.
Yeah. Yeah. And I think efficiency is the big thing that I talk with my clients, how to get more efficient, right? Not busy. And I think this is a way that the assistants and the doctors can be much more efficient. They can process much more patients if they've pre-scheduled the care, the agreed upon care, right? Once the patient agrees to it, if you pre-schedule it, and even wonderful if they're able to prepay, it's much more efficient for the front desk. It's like a gym membership, right? People walk in, boop, they scan their card and off they go. They have a little greet and they go to their adjustment. So it's really, if docs out there that are listening to this, if you want to get more efficient, today's call, you want to pay attention to it and put some action steps into your practice. So there are some critical things in place before a patient agrees and commits to a schedule. I want to be careful with this, that if you're not doing these things before you get a patient to agree to care, you're going to have difficulty getting them scheduled in. So we touched on this before, But your consult is really key. Your consult focusing on the patient's goals, why they are there. You have to do this with the patient, right? If you're not discussing their goals, they're not going to be really excited to agree to a schedule of care. Your exam must demonstrate the problem. Okay, we've touched on this on previous calls. And I know, Greg, they're recorded. So anyone that's listening to this, they can go back and listen to these calls. So you don't have to repeat it. But your exam has to demonstrate to them what the problem is. And then your report must connect those two and offer a solution to their goal. So you have to have a great consult, understanding why they're there, a great exam demonstrating the problem, and then doing a good report connecting the two. If you're not doing those three things, you're going to have some difficulty in them agreeing to a schedule of care. Now, two times when the patient enters into agreement, there's mainly two times. First one is right after the report of findings. That's everyone thinks about. Right after the report of findings, patient agrees to care and they start to schedule, right? You give your recommendations, whatever it is. Every office is different. Typical office, if they want to do 3 times a week for 4 weeks, twice a week for 6 weeks, whatever the schedule is, you want to follow up. Once you've done everything right, you want to follow up after you give those recommendations with, are there any questions? Okay, right directly after you give those recommendations. Why would you follow up with, are there any questions? Because it gives them an opportunity at that point to say something, right? Whether you agree with it or not agree with it, or they can't afford it, whatever. You want to give them an opportunity to speak so you can address any of those issues, right? Once you've done that and you end the report of findings, you must ask one question, okay? And that question is, are you ready to get started? Okay, and what you want to get is an energetic yes. If you ask that question, are you ready to get started? And you get an energetic yes, the patient is giving you the nod that they've agreed to that schedule of care, right? Once they've agreed to that, what do you think the next thing is to do? Dr. Carla, is it to adjust them and then just book the next appointment? I'm being funny.
No, absolutely not.
Let's take an example in our office. So patient agrees and I say, are you ready to get started? And they have an energetic yes. I don't talk anymore. I don't say one word. The thing I say is, okay, great. We're going to bring in Olivia, our staff member. She's going to go through any questions about finances and scheduling. Okay. So I do not adjust the patient or treat the patient until Olivia has done her, we call it a CA report or assistant report. Okay. Now, why is it important, Carla, to have that assistant come in and go through the basics of care? If you could just touch on that quickly.
Yeah, so what typically happens is the CA comes in, the doctor revisits the schedule recommendations in front of the CA with the patient. So this is again another opportunity where the patient agrees to that program, not only with the doctor, but now with the front desk. We step out of the room, allowing them to discuss fees, how they'd like to pay, scheduling, and it's an opportunity where, again, they are able to bring up any hiccups that they might have. So this is a time where they might mention not wanting to commit to the program or having issues with frequency or finances. But again, you're rehashing it before you've gone a step further and laid a hand on them for the adjustment. If that does happen, that's where the CA basically just tells the patient, I don't have the authority to change the schedule, so I'll go get the doctor to revisit that with you. And for your CAs, this takes them right out of the game. It's not their responsibility, it's not their problem, but it allows you another opportunity to revisit that with the patient.
Yep. I like it because you're getting two yeses. The first yes is, are you ready to get started with care? They say yes. We bring a staff member into that room. Now, everyone office is different, but I love this method. It was taught to me years ago where you bring the staff member in and you repeat the schedule. So if Greg was the patient and you were the staff member, I'd say, Greg or Carla, Greg has agreed to 3 times a week for 4 weeks, twice a week for 6 weeks. And Greg is shaking his head, right? And we get another, does that work? And he get another yes. Now what's happened, he's told me yes, and he's told my office staff yes. He said two yeses, right? And if you can do that, I'd say the majority of the times patients will agree to the care, start the schedule, and most of the time keep to it. So you're getting two yeses and you're avoiding any issues. And there might be issues, right? But I'd rather know about it now than chase a patient 2 weeks down the road when they're not showing up. I can't start this, I can't do this. That's fine. Let us know now. There's no reason why we need to play a game down the road. Let's deal with the issues now. And if you need to change the schedule for the patient to make it more affordable, as long as it's not compromising your the care, then do it now versus do it down the road. So I really like this method of the staff coming in, going through the schedule and actually scheduling it out and then offering a prepay. I know every province and every state is different. We love the idea of a prepayment. We offer a little bit of a discount, and when they put a block payment down, they're just coming and going and getting a receipt. It's very efficient for those of you who are trying to increase your efficiency in the office. The patient checks in, has her adjustment, walks out, and the staff, this is how we're able to process 600 plus visits a week on two front desk staff, is because we've got everything systematized and most people are pre-scheduled and a lot of people have prepaid. So I want you all on this call to consider that and do what's right fit for your office. So the second time that people agree to care is right after a re-examination or when the patient has been away for care for some time. So when you have an examination, we call it a complete exam in our office. Could be a re-exam in your office, whatever terminology you're used to using. But it's time to make another decision about the next phase of care, right? If it's their first large re-exam, then you want to use language like, we're definitely on our way to reaching the goals that we discussed. Based on our discussions, we'd agreed to dropping down to once a week for 12 weeks and then doing another re-examination. Does that work? So you're leaning towards, hey, we're on board. We've done this phase of care. We're on our way to our goal. We're dropping to once a week for the next 12 weeks, and then we're going to re-examine you. Does that work? And what happens when you do that is 9 times out of 10, the patient shakes and goes, yeah, I'm on board. Because we've eliminated all those people that maybe not be getting results or haven't agreed from the beginning. But if people have agreed to care and you're a good practitioner and they're sticking around for 1 or 2 months, most of the time, if you've done this process and you recommended the next phase of care, they're going to say yes. And guess what happens when they nod their head and they say yes to once a week for 12 weeks? Greg, what do you think we do in our office when a patient nods their head and said, yeah, that sounds good? What do you think we do?
You probably put them right into the calendar.
Well, amazing. Yeah, absolutely. Okay. So Greg, I know you like Monday mornings at 9 a.m. Does that work? Yes.
It
Okay,
does.
we'll get you scheduled in and Olivia will talk to you about your payments. That simple. It's really that simple. It's not complicated, right? If they're a regular maintenance patient, right? Let's say Greg is coming once every 2 weeks, right? And it's time for his re-exam. When his re-exam is done, hey, Greg, happy with care? Absolutely. I see you've been coming every 2 weeks. Does that work? Great. Okay, guess what happens? We do every 2 weeks for 12 visits or whatever you guys do, 24 visits. It gets it pre-scheduled in. Some of our schedules go a year, some of them go 2 years, right? Now, does the patient have the right to stop care at any time? Absolutely, right? There's no games, no gimmicks. In fact, often when patients agree to agree to care, I follow up with, okay, now, anytime if you want to stop care, if you feel like you've had enough, just let us know. We're happy to put your file in inactive and we'll welcome you back when you're ready to return. So that sets the stage for, yes, we've agreed to this care, but guess what? If you feel like and they're going to anyway, they're going to make their own decisions no matter what. But you're saying, hey, it's a safe place to let us know to stop care and we'll welcome you back when it's time to pick up care at any point. So I love that language, but if they say yes, I make sure we schedule them out that 12 or 24 visits. So I know that nobody's got their cameras on, but are there any questions at this point? Going once?
Yeah, you can still put in the chat if you do have a question. And I have a question about this, or maybe just a comment. I talk to docs, as everybody knows, all day long. One of my questions to people who are interested in the program, but they haven't come on board yet, is, do you have any idea of what your patient visit average is? And I would say 3 to 4 say, I don't really know. I don't really track it. I should. something I should do. So how do you think this affects? Obviously, the answer is probably a little contrived, but do you think this is a pretty big factor in why yours is such a high PVA?
Yeah, a lot of people I find don't, it's like their finances. They don't want to know because they don't want to know.
Right.
That's probably a little bit harsh, but they don't want to uncover the blanket and see what's there. And they don't want to start pulling the strings in order to get their game up. But sometimes this PVA is a practitioner problem, a focus problem, and then it's complicated, right? Sometimes it's as simple as they're just not scheduling properly. They don't have the right systems and procedures. They can be great practitioners, but lousy at systems and procedures. And we've talked about this before. Some people say, I really don't want to do systems and procedures. I'm not a business person. I'm a practitioner. Guess what? That's not reality. Okay. Most of us don't work in hospitals. We don't have overhead, but we have a business, right? In order for a business to run, you got to have the, I find if they're really good practitioners, then it's a systems and procedures problem. And PVA just gives us, which is patient visit average. How many times does a person visit the office? It just gives us an insight into how your ability to communicate with the patient is. Because most people, if you talk to enough people throughout the world, is they want to get better and they want to stay better. Very rarely, it's rare, people want to get better and take off. That's okay, right? That's fine. And it's a small part of the population. But the majority of the people want to get better and stay better. Why is the wellness revolution booming, right? People spend money on gyms and healthcare. They want us to get better and stay better. So if we feel we're part of that, and why don't we tell them and help them stay, right? So if your PVA is low, it's probably a mindset problem and a method problem, right? So it's a mindset problem and a method problem. But yeah,
I
PVA.
agree.
Sorry.
I agree. I was gonna say, I think the scheduling, like you asked, Greg, I think it's one part of it, but I think it's also about being open and forthright with people, because telling them or recommending a schedule is one part of communicating to them what the expectations are. So this isn't just going to be a 1, 2, 3, you feel better and you're done. This is what we are offering you, is the opportunity to stay on for long-term benefit. And it's out in the open, and they can choose it or not choose it. And we are 100% truthful where we say people can do it or not do it. But we're going to tell you what we think you need based on what we've shown you in your exam in order to get better and stay healthy. And yes, I think the scheduling is one piece of the puzzle, but openness about why we have that expectation is a lot of what goes towards the higher PVA too.
Yeah. And I know we're getting off topic, but this is very relevant. Medicine tries this symptom care, right? It's already there. Symptom care is already in medicine, and take a pill, that kind of stuff. And patients have the option to go do that, right? They can choose to go get a pill for something to make them feel better, but they're in your office more than likely to avoid taking medications, right? So they're already in the wellness mindset, right? So why have that medical mindset of let's get you 3, 4 visits and get you better? We should already be in a wellness mindset. I love I know this is off topic, but our little script above our front desk, the stuff, the decals you stick to the wall, says chiropractic is a lifestyle, not a treatment, right? And the scheduling call today is about getting patients to understand, hey, this is a lifestyle. You go to the gym, you eat well, and you get your care, whatever it is. If you people on the call can just get 3 or 4 things we talked about today into action, I guarantee you your practice will go up and your PVA will go up. I have a client, I kid you not, that started in January, that all we've been talking about is this, Greg, a coaching client. And all they've done is worked on this, and they've increased their practice by 30%.
Wow.
30%. Great practitioner, young practitioner, didn't understand scheduling, didn't understand pre-scheduling, didn't get it. All we've been doing for 6 weeks is getting the details around this into play in their office, and they're up 30%. Actually, it's more this week. It's close to 40%. If they were seeing 100 people a week, they're seeing 150 people a week. Their practice is up 50% just by incorporating what we talked about today. And that's what actually inspired me to bring up this topic, because I'm hopefully, if whoever's on this call or watching it, if they can take 2 or 3 things and apply it, they can get their practice up to another level. And the last thing I'll leave you all with is, if you're not confidently, remember this, if you're not confidently doing this, someone else will. So just remember that.
So
Uh,
can you recap what those points were again? You said take the 2 or 3 things, or is that, do you
I
have them
think the
written in a
big,
list?
yeah, the big thing is number one is your consult, exam, and report have to be elevated. That's the first thing, okay? And looked at, practice, elevated. Number two is having your staff come in after you've got a yes. So you get a yes, you get a second yes, your staff comes in and pre-schedules them out, right? And the third thing is to do the exact same thing after the re-examination. Those are the three biggies. If they do that, you'll start to see schedules get implemented into the programs and you'll start to see numbers go up. So those are big three.
Awesome.
Carla, did I miss anything, Carla?
No, I just think like for any docs that are listening, it's take the leap. You'd be surprised how many patients like this. I think people are worried that they're going to feel like they're pigeonholing people, but if you've done a great job with the things that Angelo already described, asking them to book things out just often makes it easier for them. And I think people are often hesitant because they don't want to make people feel like they're pushing them or forcing them to do something. It's they're committed and they have the opportunity to change their mind if they want. But you'd be surprised how many people love this. They get the same day, the same time. It makes it easy for them.
I'll second that. I'm just thinking of my own situation. I've got a new doc I'm visiting in the area and he's great. And we've been booking week to week. And I'm thinking to myself on this call, next time I go in, I'm just going to book out every day at the same time. It makes my life easier.
Yeah.
Yep.
Because what happens, Greg, next week, if you go to get 9 a.m. and guess what, if you haven't pre-scheduled it, 9 a.m. might be taken. And now you're going, I don't like 11, I like 9.
Yeah,
And
it's my time.
yeah, that's right. Yeah, for sure. Excellent. Any other questions, concerns? Going once, going twice.
Got a few people on here. You can hop on, you raise your hand if you want. It's the
I
benefit of a
know.
live call.
The thing that blows me away is not so much because a lot of people watch the recordings, as we know, but we're available for questions. And I remember if I was in my first 3-4 years of practice, I would have been on here asking a million, having our time one-on-one for even 10-15 minutes. Maybe we'll have a,
Oh, there we got Dr. Paul. There he
Dr.
is.
Paul.
How you doing, guys?
Good, yourself? Good to see your face.
Good. I was in the car, that's why I couldn't really get things going.
That's
But
okay.
I really enjoyed this.
Yeah.
Glad to hear that.
What we're trying to do, Paul, is we're trying to have connect a community of us together so we can share our wins and challenges, listen to a little bit of what we have to say, and really elevate everybody's game. So that's what these calls are about. And hopefully we see you again and other docs. So thanks for hopping on.
For sure. You're welcome. Thank you.
Yeah. All right. If there are no other questions or concerns, that'll wrap up this week. We'll be on next week. I've got a few surprises up my sleeve, and hopefully we can get some docs on live so they can ask any questions.
All right, that's great. Thanks, Angelo.
Thanks, guys. Thanks, Greg.
Have a good week.
See you, Dr. Paul. Have a good
Take
week,
care.
everybody.
Bye-bye. Bye-bye.
Bye.
Bye-bye.